The vaccine requires 2 doses, 21 days apart, and from the data that's been presented to us, people will be immune 7 days after the second dose. A partial immunity does occur after the first dose, and we can see some protection occurring after day 12 after the first dose, but the best immunity is 7 days after the second dose.
The risk of dying from COVID-19 is very strongly associated with age. Age is by far the single most important factor in terms of risk from COVID-19. The second strand to the advice is regarding implementation of the vaccination program. And we advise that due attention is paid locally to mitigating health inequalities. Residents in care homes for older adults and care home workers are the highest priority. Following that are those 80 years of age and above, alongside frontline healthcare and social care workers. Then come those 75 years of age and above, followed by those 70 years of age and above, alongside people who are clinically extremely vulnerable because of specific health conditions. They're followed by people who are aged 65 years and above, and then individuals who are aged 16 to 64 years with underlying health conditions that also put them at risk of COVID-19, but where those conditions are not already represented in the conditions putting somebody at clinically extremely vulnerable risk. The prioritization order then continues down the age groups until all those aged 50 years and above are included. The whole reason why a priority listing is required is because we expect during a pandemic that vaccine supply will be limited in the first instance. And so vaccines should be offered in the first instance to the most vulnerable, moving down the priority list. We will need as many vaccines as we can get, not just in the UK, but globally. And this includes more than one vaccine type in order to reach all the people who are at risk from COVID-19. So this is the start of a program and not the end of a program. We suggest that community teams work together to mitigate against health inequalities that might occur in relation to ethnicity, deprivation, or access to healthcare. We also recognize that there may be operational reasons why the prioritization needs to be more flexible. And this may relate to vaccine characteristics or vaccine supply or exceptional personal circumstances.
It is stored at -70 degrees, but we were able to look at stability data, and the stability data is showing that it is stable for a short period of time at 2 to 8 degrees, which allows it to be transported to the relevant vaccination sites.
This vaccine, produced and developed by Pfizer BioNTech, meets rigorous high standards of safety, of effectiveness and of quality. The public's safety has always been at the forefront of our minds. Safety is our watchword, and it will always continue to be.